So I think the first thing to do is we should have a round table so we can know each other a little bit better. Because as you know, we are going to have theoretical sessions in the morning and practical work in the afternoon. So it's good to know each other better. So I'll start myself. I'm Luís Lapão. I'm professor of International Public Health Information here at the Institute and at the University Nova de Lisboa. I've been working with InfAct for the last 3 years, and we have been coordinating the work package 6 on capacity building, and we also have been working on telemedicine and digital health, and we are going to talk about that during the course. I will ask my colleague to present himself.
Good morning, everyone. Can you hear me well? Yes? Okay. Yes. My name is André. I've been talking by email. I'm working with Professor Luís Lapão in the InfAct. I'm a PhD student. I'm working in international health and human resources for health. And I'm here to support and to participate in the course. Thank you. Okay.
Would you name the?
Yes. So we will use the list of participants to do the round table. We will start with Anna here. Anna.
Yes. Hello. First of all, I'm really sorry this computer doesn't have a camera, but I'll make sure that next time I have a computer that has the camera. So yeah, my name is Anna Mihor. I come from Slovenia. I'm a public health resident here. For 2 years, I was employed at the National Institute of Public Health, but now I'm actually employed at the Slovenian Cancer Registry. I started a PhD where I will look at the burden of long-term effects of childhood cancer treatment. And I'm still looking into it, what are the options for linking data to get maybe, to compare how hospitalizations, link other information databases in Slovenia. Thank you.
Okay, Angelo.
Hello, everyone. I'm Angelo D'Ambrosio from Italy. I'm also a public health resident, and I'm at the end of my specialization, and I work until now mostly on healthcare-associated infection and antimicrobial resistance. And the last year I was the European Center for Disease Control in Stockholm, where we started about taking care about healthcare-associated infection. Then we ended up working on COVID full time. And since many years, also before my specialization, I always work in digital health projects, building platforms which uses internet data to perform public health studies, and also for the COVID. Together with other people at the European Center for Disease Control, we built a platform that scraped data from all the European websites about the COVID epidemiologic situation. I will be finished my specialization in 1 month, and then I will start a PhD in Freiburg, in Germany, about the network analysis of the spreading of antimicrobial resistance in the hospitals.
Okay, that's it. Sarah, Blanca.
Yep. Hello, my name is Sarah Burgmann, and I'm working at the Institute for Public Health in Vienna, in Austria. I'm a little bit fresh here because I started on July. So before I worked at the Institute for General Practice and Health Science Research at the Medical University of Graz. I'm doing health science research with focus on primary healthcare. And I'm also doing healthcare research and planning and yeah, with focus on primary healthcare, also at the National Institute for Public Health. And I'm also doing my doctoral thesis in establishment of primary healthcare centers in Austria.
Okay, thank you. Blanca?
Hi everyone, I'm Blanca and I'm also a public health resident here in Spain. I'm doing my last year in my residence, and right now I'm working with Isabel in mental health, in investigation in mental health related with suicide, and that's why I am in this course. And I want to do my PhD in this kind of investigation. Thanks.
Okay, gracias. Susana?
Hello, everyone. I hope you hear me. I will start. I don't know if the video works. So I'm Susanna. I'm a PhD student at SCIENSANO, the Public Health Institute of Belgium. I started November last year, and I'm doing my research on obesity and how the local environment has an influence on a healthy lifestyle. And we also use a local surveys and co-creation.
Okay, thank you. Claudia?
I'm working. No?
No, it's okay, it's okay.
Hello, can you hear me?
Yes, perfect.
My name is Claudia Dima. I am a senior medical doctor, public health and management specialist, working in the unit of health promotion and education for health at the moment. I am working for more than 20 years in public health, and I am interested especially in data related to behavioral science that are useful for my work. But also I am representing Romania as a WHO focal point for health systems, and I am interested to find out more and share knowledge with my colleagues across Europe about health information systems.
So let's, Derek?
Thank you. And my name is Lăcrămioara Brândușe. I'm the colleague of Claudia Dima in the National Institute of Public Health in Romania. I'm a senior physician specialized in public health and management. And at the moment, I work in the National Center of Statistics in Public Health, and I'm a senior lecturer in medicine in public health and management. And I'm interested in this training school in data analysis and collection, because I will be the coordinator of European Health Survey in Romania.
Yep. Derek?
Good morning, everyone. My name is Derek. I work for the Health Research Board in Ireland. I work on the National Health Information Systems, focusing primarily on drug reporting. We've spent the last number of years building a system to go completely online, completely electronic, real time with data cleaning as people are entering it. So I suppose I'm hoping to use this course to understand better data linkage, as we have a number of different data collection systems under the one website, and also utilize things like deprivation indexes and stuff to move the data forward.
Okay. Now, I don't know if I will say it correctly. Here. No one? Oops. Here? No? Okay, so let's hear Anna from Finland. Yes. Anna, can you hear us?
Okay, here we go. Sorry, I had a problem with unmuting myself. Hello, everyone. My name is Hanna. I come from Finland. I'm working for the Finnish Institute for Health and Welfare at the moment as a project researcher. And my background is mainly on rehabilitation and physiotherapy. So I've been working on a public health field for around 11 years, mainly doing clinical work. But now I've been doing this research work for 1.5 years. I'm a master in health sciences. So I'm in the beginning of my academic career, let me say so. So I'm looking forward for this course in order to learn more about the data linkage and data management, health informations, how they can be sort of linkaged together in a European level. Mainly I'm working for the European Union projects at the moment. So basically I'm involved with the InfAct already. And there's another big EU project called HPM for EU, which I'm involved with. So looking forward to get to know you all. Thank you.
Thank you. So let's Iriza.
Yeah. Hello, good morning. I'm from Latvia, and can you hear me?
Perfectly.
Okay. And my background is public health and epidemiology, and I work in Center for Disease Prevention and Control. And we also participate in InfAct project, also Peristat, and I also work more with maternal and health statistics and data, and also with medical birth register, and all work is related with these health information systems, different data, and also interesting this data linkage and so on. And that's why I think this course will be very important for my work also and for research. Thank you.
Thank you. Mina? Hello? Oh. Okay.
Sorry.
Okay, no problem. So, Rita? No.
Hi, so was it me you mentioned? Was it Meka?
No, it could be.
Sorry.
But it could be, no problem. Go ahead.
Hi, so my name is Meka, and I was working with hospital and patient inquiry data and the diagnostic-related diseases about the activity funding in the hospital groups in Ireland. But recently, from July, I moved to United Kingdom, and I'm working on COVID-19 and diabetes infections, and I'm a Health Pros Fellow.
Okay, Mika. So you have Mina's presentation on the chat, if you want to read it, and we will listen now. Oscar, read it.
Good morning, everyone. My name is Oscar. I'm Portuguese. Currently, I'm based in Amsterdam. I'm also part of the Health Pros Network, which is a Marie Skłodowska-Curie innovative training network, a EU-funded project, which seeks basically to link more effectively data to better strategic decision-making. I'm currently in my second year toward a PhD degree at Amsterdam's University Medical Centers.
Very good. Okay. Thank you, Oscar. So Mina says, hi everyone. Unfortunately, I cannot talk at the moment, so I will briefly introduce myself. Here I am, a medical doctor and a recently epidemiologist, Master of Science, and I'm working at the Institute of Public Health of Serbia at the Epidemiology Department office for surveillance of infectious diseases, working currently on COVID case tracing and managing COVID-related regulation in the school system. Yes, COVID. Everyone is working on COVID. Okay, so Rita from Malta. No.
Hello. Hi. Can you hear me?
Yes.
Can you hear me? Hi, I'm Rita McCallum from Malta. I'm a senior staff nurse and manager of the cancer research manager of the multinational cancer register for the past 30 years. I finished my master's in health science in 2009, and I would like to be updated with new innovations of collecting data.
Okay. Dragana? Dragana?
Hello. Can you hear me?
Perfect. Yes. Okay, go ahead, Dragana.
Sorry, could you repeat?
Go ahead. Present yourself.
Oh, okay. So I'm Dragana Stošković. I work at the Institute of Public Health of Serbia, Dr. Milan Jovanović Batut, at the Department of Food and Nutrition. And I am very happy to be a part of this first international school on health information.
Okay, thank you. I think we're finished.
No, yeah, yes.
Yes, go ahead.
Good morning. So my name is Elsi Haverinen and I come from Finland also. I have my background in public and global health, and currently I'm working as a project research in the Finnish Institute for Health and Welfare. I do mainly 2 EU projects as well. So human biomonitoring for the European Union initiative, where we look at environmental chemical exposure for health. And then I've also done a small part for the InfAct work package 8, where we look at the tools and methods for health information support. So mainly mapped some different platforms. Really happy to join you in this course.
Very good, thank you very much. I see that you are the future of health information in Europe. We are very glad to have you here with us. So I will have a small presentation just to make sure we are aligned, just to have you can ask a couple of questions that you still have before Thursday. And I will move there to make the presentation.
Johan está funcionando, mas os outros tem que partilhar, tem que ser eu aqui. I will share, okay.
So what I want to say, just a couple of things, and be
Go ahead.
Okay, we need to just to say that we had more than 50 applications for this course. So we select best curriculum, allowing for having participants for most countries engaged, and so we are very happy with your participation here. We mostly cover all the Europe, and so we are ready to start on Thursday. Just a couple issues. So you at the end of each day, you will be asked to fulfill a survey regarding evaluation of the sessions. It's very important for us because we want to validate and evaluate this first European School of Health Information, but also the lecturers will evaluate the course. And one very important thing is that we allow only 80% of attendance. If you miss more than one day, you are not allowed to have the diploma. And meaning that you have one day or either one morning in the afternoon, but you have to have at least 4 days of the course in order to get the diploma of the course. So all the sessions will be run through the Zoom. In the morning, we'll have theoretical sessions with experts from Europe and from most of them are coming from the project InfAct. And in the afternoon, we are going to split you in 5 groups. And then we work together with you in order to be more practical. So each day we have a specific issue that you should prepare in group and present during the session, in the end of the session. So we'll be very active and proactive training. We are going to have, we already have a website. Can you try there?
I don't know if it's working.
Because we already have a website for the course where we are going to find, where you can find the materials. Okay. And the website is health. Yes, information. Primary care innovation altogether. Primary care innovation.org. Yes.
Nope.
It's 2 N's, innovation, I think.
Yeah, innovation with 2 N's, yes. You missed one of us.
Information. That's primary care.
And so we will, each week before the sessions, we'll provide you the documentation, the presentation, so you could have them with you.
Okay, so
information.
That's it.
Primary care innovation.org. Okay, for some reason it's not. I just need to check here. You can also try from this side.
Okay, so
Let's do it. So, for some reason it's not connecting from this room. We'll check it and then we'll send the link again to you today. So the idea is to have all access all the documentations from this website, and you will find it, and then we will provide a password, because the participation on the course will be only available for those with a password, and I think that's it. Any question from you? Any doubts you want to ask now? So no doubts, great.
We have Robert Hoffman and Vasos Kotelos in the room, so could you present yourselves, please, Robert? No. Vasos?
So thank you for participating in this session of test today to know each other better, and I hope you be ready for starting the course next Thursday at the same time, and for starting with I will start with Petronil from Belgium, and the course will finish at 17 hours. So thank you very much for your participation, and we'll be eager to have you next Thursday. Okay? So bye-bye, everyone.
See you.
It's a pity you are not here in Lisbon, but we are all together now here.
Thank you. Bye-bye.
Thank you very much.
Thank you.
Thank you. Bye.
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 Yes.